It is the life force associated with the brain and the spinal cord that dictates to those cells what they are going to become, because genetically all the cells are the same. It is what happens from that life force where it differentiates itself to becoming what cell is needed for the body to develop. Every 7 years we're a new person. So the cells are constantly dying off. Ladies know a lot about things like exfoliation. Us men tend to not be so good about that, but they're doing it. Taking the dead skin off of the upper layer of the skin so that it allows the new skin to grow out from underneath. Our body replicates itself constantly, and it is that life force that allows your body to differentiate it so that it will become those types, what it is supposed to be. So, this is really a whole different way of looking at life. Okay, it's about as different as the concept of a flat Earth to a round Earth, because you see, being healthy is your birthright. Okay, if you were born as a normal, healthy baby, then there is no reason. That means that your nervous system is functioning correctly to be able to build you a working heart, lungs, vascular system, arms, legs, all things, and then you come out as a viable, healthy baby. Then your body has all the capacity to keep itself healthy throughout its lifetime. It is then what we do to it ourselves that creates any sort of changes. So you're designed to be healthy. Good heads don't hurt. Good backs don't hurt. It hurts, something's wrong. Okay, so we kind of have to shift the concept of what health and life, what is really important, where it comes from. Many times we'll hear stories of people relating how they went, particularly in our office. A story, we spoke with Miss Van Houten here recently in one of the episodes, and she had spent a year almost going to her back hurt. I went to my medical doctor. He says it was arthritis, gave me some pain medication, and sent me on my way. Said come back and see him if it was still bothering me. It was still bothering me, so we went and did some tests, and then we went and did it, so much so that she ended up in the emergency room, and so much so that now she wasn't able to live her life in a normal way. But what was not being addressed was what is actually going on. So when we got into really looking at what was going on, well, the nerves that feed the part of her body that was experiencing pain were being pinched on by bones out of place. They're not aligned in the fashion they were. They're not moving in the way they're supposed to move, and it creates stress upon the nerve. All of you at home, just take your wrist and you just kind of pinch right in here. And if you sit and hold that for just a little bit, the next thing you'll feel is out in your fingertips will get a little tingly, and all you're pressing on is a little nerve, and pretty soon that becomes more and more tingly and more numb, and that's just putting a little pressure right here where the nerve goes into the wrist. Just imagine if it's a big sciatic nerve that comes out of the low back and affects the entire lower limb, how much discomfort and problems that a person could have. And not only are they not able to feel and give the information out to the body, but the body in the lower limb is not able to get that information back up into the central nervous system in the brain to let it know what's really going on. So when we talk about health, we really have to address how that nervous system is functioning, because it's truly the driver of the train and dictates to us about how we're able to live inside of the world that we experience on a daily basis. When we think about a tooth, if you will, during the decaying process, the tooth doesn't hurt. And I've been to the dentist quite a few times, and he's never told me when I had that cavity that he was getting ready to fill. He said, hey, you probably just ate a piece of candy the other day, and that's why that tooth is like that. No, what does he say? He says, well, this has been going on for quite some time. It only hurt when I was chewing that piece of candy the other day. And so our body is no different. The pain is a sign that it's too late, that change has actually occurred. And for us chiropractors, it is something that we have 4 huge frustrations that really leads to disaster for people when they start to look at regaining this health and allowing the nervous system to function appropriately by eliminating the interference to these things. Is one thing is put off taking care of it, or I failed to check a problem when it happened. You know, hey doc, I fell we just lived through winter, you know, and we had one this year that was as bad as I can remember in all the years I grew up in this state. And how many people slipped or fell, or maybe even didn't quite fall all the way. I just kind of slipped and caught myself on something. And, you know, for a day or two I was sore, but I was okay. Well, now the next thing you know, you go through the summer and go into the fall, and you can maybe go out and rake leaves, and all of a sudden that area of your body that you slipped and fell there, it's now hurting 6 and 8 months later. It's putting it off and never actually seeing if something is really wrong is one of the biggest frustrations that we deal with. The other is covering it up. You know, oh, I just took a few ibuprofen. I had some leftover muscle relaxants from when I had this knee surgery years ago. I just take a couple of Advil and everything seems to be okay. Not really dealing with what the information the body is giving you. And this doesn't necessarily mean that you have to go and seek chiropractic care. It means that your body is giving you some information. Pain is a clue that something's going on. So we need to be a little more quiet, a little more still, and listen to that innate voice inside of us that's saying, hey, you hurt here. You need to deal with this. I'm telling you this for a reason. And quite often we just mask it, cover it up, put it off to the side because we're busy. We've got a golf game to go to. We've got to go to work. We've got kids to take care of. And life is happening. So we're just going to put this off to the side, and maybe we'll deal with it later, and maybe we won't. The other thing is people, you know, deciding that I'm going to deal with this, and then they come in and they decide that we figure out exactly what's going on, and we sit down and we explain it to them, and we explain to them what needs to occur to make it get corrected. And then they're going along and they're feeling a little better, and they're, oh, you know what, that was enough. Well, let me ask you this then. If you go to the medical doctor and say you're going for a rash, and you've gone to a dermatologist and he says, here, take this prescription of this salve, go get it filled and use it for the next 30 days. And you start putting it on there for a couple of weeks and the itching goes away and it's not bothering you so much and you stop dealing with it. Well, all of a sudden the rash spreads. Well, it's the same thing when you come into our office. We do these things for a reason. The body heals on its timetable, not on ours. We get in a big hurry. We want it fixed yesterday. Well, when it happened 6 months, 6 years, 20 years ago, and the life processes have gone on during all that time, it cannot be undone over a very short period of time. Just like we recently, a little over a year ago, had our 3rd child. My wife would have loved it to happen, but that healthy, beautiful baby boy did not occur in 4 to 6 months. The body had to have 9 months to deal with it. It's not our rules. It's the way the body heals itself. So the body is going to function on its own timetable. And so we can't hurry these things. We have to look upon it in an appropriate way, in a realistic way. I have a big exercise background, and so I like to relate it to that. If you decided that you wanted to become stronger or run faster or farther, or just, heck, be able to bend over and touch your toes for once, you wouldn't start doing it and expect to be able to, you know, lift more weights or run farther or faster or actually reach your toes in just a short period of time. You know that the body has to adapt accordingly. So you're going to give it time. The same thing happens when you start to deal with things on a rehabilitative basis. You have to give the body time to adapt